Hello, I'm Dr. Heather Woolery-Lloyd. I'm the Chief Medical Advisor at Nutrafol. So I think this study is really interesting because quantifying linear hair growth rate is actually not something that's typically done in clinical studies when it comes to hair. So typically what we're looking at is hair count, either increase in total hair count or terminal hair count, or we might be looking at anagen-to-telogen ratios. But this is actually something different. It's looking specifically at the rate of growth. And this is something that's not easy to measure, and that's probably why it's not frequently done. But in this clinical study, we looked at 4 of the different formulations of Nutrafol, and we found a 19 to 37% increase in the rate of growth, which is really quite remarkable and really exciting. So it's been hard to measure linear hair growth rate because it involves quite extensive study procedures. So in this study at baseline, a small area behind the ear was shaved. And then the patient came back in 48 hours later, and they were able to measure the rate of growth over that short period of time, those 48 hours. And then they started on the supplement which are depending on what group they were on. There were 4 different supplements, Nutrafol supplements that were tested. And then they came back at 3 months, at 6 months. But again, they had to have that area shaved again, come back 48 hours later to see the rate of growth during that time period. And again, it was repeated at 6 months. So it's not the most straightforward trial. It involves the patient coming in twice at each time point and also having a little area shaved so we could actually measure the rate of growth. So it's not an easy study design, but I'm so glad that we did this study because it's really interesting results and very meaningful results for patients. So definitely the why makes a huge difference because the type of hair thinning that you can see in a woman who's experiencing postpartum hair thinning is very different than the hair thinning that an older gentleman might be having from aging, for example. So in the young woman, she might, after pregnancy, you see a big change in hormones that can push the hair out of the active growth phase into the resting phase. And what we see is shedding around 3 to 6 months later. And on top of that, pregnancy and childbirth causes a lot of physiological stress, and that also influences thinning. Whereas in an older man, for example, who's experiencing hair thinning, that hair thinning may be to do different things like metabolism, changes in metabolism, changes in the thickness of the dermis. Like I always explain to people that the hair grows out of the scalp, and the scalp is kind of the scaffold, the structure that the hair grows out of. And as we age, we know the skin on our face kind of thins with age, and so does the skin on our scalp. So basically, the scaffold or the structure also changes with age, and you grow a less healthy hair, a less thick hair. So the thinning that is associated with the age-related thinning, let's say in an older gentleman, is very different than the thinning that we would see in a woman postpartum, and therefore they would require a formula that has ingredients to address those specific root causes.